evening, Adelekam. Thank you very much. Good evening. You're welcome. You're all welcome. Thanks for joining. I see you. Please make sure to share the video so that other people can join us. Just help me to share and do not forget to give the video a thumbs up as you join. Hi, Christy. I see you. Thanks for joining. Please share the video so that other people can join us. I'm trying to share the video also, so just help me to share because today is going to be a special day. So let's share so that people can join us, okay? Let's just join the show, please. Hello, everyone. You're welcome. You're welcome. Thanks for joining. You're welcome. Hello, everyone. Thanks for joining. You're welcome. Please just help me to share the video so that other people can join us because today is going to be a wonderful day. Hey, Samson, all the way from Malawi. I see you. Thanks for joining. From Malawi, you're welcome. You're all welcome. Please do not forget to give the video a thumbs up as you join and let me know in the comment section also. Is my voice okay? Is the volume okay? If my volume is okay, I would like you to confirm with me so I know my volume is okay. So let's share the video. While we are waiting on others to join, please just use this moment to share the video so that people can know that we are live. Like I said, today is going to be a very special day. If you all have seen from the poster, we are going to have a guest with us today. So this knowledge is something, okay, it's okay, voice okay. Thank you all very much. Thank you, Joy. Thank you, Adelekan. Thanks for the confirmation. Hey, Dr. Damilari, thank you very much for joining. He said, I can hear you clearly with earphones. Oh, okay, it means that my volume is great. So thank you all for the confirmation. Dr. Damilari, I see you in the building. Thank you very much for joining. It's good to be here. My pleasure having you also. Paul says the voice and volume is okay. Thank you very much, Paul, for the confirmation. So today is going to be a wonderful day. It's going to be a day that we all are going to learn because somebody special, somebody higher is going to join us to educate us on certain things when it comes to our health. So I will appreciate if we all can share the video so that other people can join us, so that other people can learn from this information that is going to be shared with us today. Even if it is on your WhatsApp status, just share it. You don't know, maybe somebody can find it there and join us. So help me to share the video before we start the show. We will not waste time. In 5 minutes after 8 p.m., I'm going to start the live officially, loud and clear. Thank you very much, Ikechukwu. Ikechukwu says loud and clear. Samson said the volume is fine. Okay, then we are good to go. I'm so happy to have each and every one of you. Hello, my beautiful people, diabetes warriors. You are all welcome to Diabetes Mindful Talk. So share the video. Let other people join. I'm trying to share here also because I need people to join us and learn from the information that is going to be shared here today, because it's not something that you are going to find everywhere. This information, you need to go to your doctor before you get the information that you are supposed to hear here today. So today you are getting it free of charge, no consultation fee. So everything is free. So help me to share it also so that people can join and learn from it. I'm doing same here. I'm sharing it also. Like the videos, just hit on the three dots at the top right hand side of your screen and then choose on the option thumbs up or like. That is how you like the video. There is no special way for you to like the video. You just need to give the video a thumbs up by clicking on it. And when you do that, other people will join us. So please help me to share. I'm sharing the video also. Couple of shares, so I will leave it at this point and then we can start our show officially. Like I always say, I have a phone with me here, so if you see me looking this way, no, I'm trying to read from the other phone. So yes, hello beautiful people, you are all welcome. You're welcome to Diabetes Mindful Talks. Thank you very much for your time. I'm your host, Mira Bekono, your diabetes educator. So we are here today again on this special occasion, a day that we are going to learn because it's going to be something great. We are not going to be talking about sugar. We are not going to be talking about food, but today we are going to be talking about something else. Like we all know on this channel, most often we talk about food, we talk about sugar, but today we are going more deeper into diabetes. We are going to talk about a problem that is silently damaging the lives of many people, and especially people who are struggling with diabetes. So today we are going to talk about urinary problems. We are going to talk about how it's affecting erectile dysfunction, how it affects the bladder, and also more things. And if we can all be honest to ourselves, these are common problems that are being faced mostly by people who are managing or struggling with diabetes. But today we are going to talk about that. We are going to look for solutions. So if you are here, you have been struggling with any of these problems, maybe you are having problems with your bladder, you are having problem when it comes to intimacy, or you are having problem because of these problems that you don't know how to even express yourself, you don't have this self-confidence again. Today is another day that you are going to learn from this show and going to regain your confidence back. So that is why I have taught it, and I said it's good I invite somebody to us, somebody that is going to educate us more deeper into this topic. And it is a special guest. He is a special guest. He is a doctor, not any kind of doctor, but he is a urologist. So today we are going to have a urologist with us who is going to help us to understand how the urinary system affects diabetes and what we can do to fix this problem. But before I invite our guest speaker to the show, I will want to ask you all, for those of you who are watching me, I will want to ask you to drop in the comment section, have you been experiencing frequent urinations? Do you have that problem where you constantly wake up at night and go to the bathroom just to pee? If you are facing such a problem, I will want you to type it in the comment section. Or do you have or experience weak urine? Some people, they have problem when they go to the bathroom to urinate. It doesn't come out with that force like how a normal urine has to flow. Some people have this problem of weak urine flow. So if you are experiencing weak urine flow also, drop it in the comment section. Do not be shy to drop it in the comment section. Use this moment as a moment for you to learn. I am also here to learn because this is not my field, and that is why I have brought in a specialist to talk to us. So before I invite him, if you know that you are struggling with any of these problems that I have made mention of, be it frequent urination at night, be it a weak urine flow, or maybe you are having problems with intimacy, also drop them in the comment section. And I want to remind you also that know that this moment is your moment to learn. So if you have any questions, do not be shy to ask your question. Feel free and ask your questions, knowing that you are going to get your answers from a specialist. He is no ordinary person. He is a doctor who specializes in urinary system problems. So feel free to ask your questions. This might be the opportunity that you might get answers to the questions that you have been looking for. So without wasting much of our time, I will want us to welcome our guest, who is no other person than Dr. Oro, a practicing urologist. with years of experience helping people to manage urological conditions linked to diabetes, aging, and also men's health. So we would like to call on our guest speaker, who is Dr. Oro. Dr. Oro, if you are there, please, you can send a request and join the show. So help me to welcome Dr. Oro. So, Dr. Orok, if you are there, please, you can join the show right away. Let's just give Dr. Orok a few seconds. He's going to join us. Okay, I see constant urinating at night. That's a good one. Constant urinating at night. You're going to have answers to your questions. Don't worry. Just keep giving them. If you are having problem with your urinary system, please drop them in the comment section. Our doctor is going to answer also. Let's welcome Dr. Orok to the show, please. Dr. Orok, if you are there, if you are listening to me, please, can you join the show? So I'm waiting for Dr. Orok to join us, please. So we have Dr. Orok in the house. Please pump some love to our doctor. Dr. Orok is in the house. Please just send some love to our doctor. He is with us present. Doctor, is my volume okay?
Yeah, it's okay. I
Okay,
don't know if
thank you
mine is
very much,
okay.
Dr. Oro. Thank you very much for joining us today. We truly, truly honored your presence here, and I say we are glad to have you in our midst today. Thank you very much, Dr. Oro. You're welcome.
Thank you. It's my pleasure.
Okay, you're welcome. So, Dr. Orok, if you don't mind, please, can you maybe introduce yourself to my audience? Maybe just tell us a little bit about you so that we know who we are dealing with today, please.
Okay.
Maybe
Thank you
if
once
it's
again.
possible, can you increase your volume a little bit because it's a little bit low.
Oh, okay. Are you getting me now? Maybe I take off my side piece, my earpiece. Sorry. Are you getting me now?
I'm
Okay.
getting you, Perfin. I don't know if the viewers are getting you. Let me check from the viewers if they are getting you. Please type in the comment section. Are you getting our doctor? Is his volume okay? Is his volume good?
Or is it still faint? Are you getting me?
I'm getting you, doctor. I'm getting you.
Okay. Okay.
I
Thank you
see
once
some
again.
people say no, they are not getting you. Some people say yes, they are getting you. Maybe come a little bit closer.
Okay.
Yeah, but I
Okay.
can get you now. I can get you good now.
Okay.
Yeah.
Yeah, I'm Dr. Agbo Orok, a urologic surgeon. Yeah, urology is the branch of medicine that deals with the medical and surgical aspect of the urinary tract in humans, as well as the genital and reproductive system in males. So it deals with the urinary system in both male and female, and then the genital and reproductive organs in males. So that's what it's all about. So it's both a surgical and a medical specialty. Okay, so as you all know, I'm from Cameroon. Yeah, I did my studies in Cameroon, practice in Cameroon and other African countries. I'm presently here in Belgium, where I'm to start my practice. Yeah. So, mhm.
Congratulations.
Yeah, I have. Yeah, I think that's just me. Yeah, with I've been practicing for over the past 12 years. So, in summary, that's who Orok is.
Oh, thank Much, doctor. So from what I can deduce from your discussion, it means you've been practicing as a doctor for over 12 years now. And for these 12 years, were you already a specialist in urologist, or you've done it just for a couple of years? Or
So a specialist in because the training in urology take at least 5 years after doing your general medicine.
okay.
So yeah, during that period of training, you are also practicing. Yeah, but I've been as a consultant urologist for the past almost getting to 4 years.
Wow. So, yes, it means we are really talking with an expert. So, our questions are definitely going to be answered today. So, I'm calling on each and every one of you watching me. If you have any question when it comes to urologist problems, please do not hesitate. If you have problem, even if it is with your bladder, anything that you're struggling with, like you all heard him say, he is specialized in the male genital organ. So, if you are a man, you are struggling with whatever problem, especially erectile dysfunction, and you need a doctor to talk to, this is your chance to talk to somebody who is definitely going to give you some answers. So thank you very much, Dr. Oro, for that introduction.
You're
Doctor,
welcome.
my platform, we talk mostly about diabetes. And if you can see, you know that diabetes is something, it doesn't only affect blood sugar level, but diabetes is something that affects the whole body. And many people who are struggling with diabetes, most of them, they tend to have this problem of like constant urination. And most often it happens at night. So what causes this constant urination? What makes these patients to constantly go at night to pee?
Okay, thank you very much. Normally, when somebody goes at night, one time is okay, but more than once it becomes a problem. Normal, healthy human, normally you are not supposed to wake up at night to go and pee, or at most you are supposed to get up once at night to go and pee. So, for diabetic, it's always constant because first, the increased blood sugar, the increased level of sugar makes it gives them that symptom to urinate frequently, first of all. And then it can also happen as a result of the complication. That is why they pee too much, which we are going to talk about. Yeah, because it's a gradual process. It's not like when you become diabetic from day one, uh, you going to pee frequently is as a result of complication. It could just be just the warning signs that, okay, you are diabetic. Some they don't even know, or your diabetes is not well managed. Now, once the complications set in, those symptoms can also play. Yeah, frequency going at night. So it's always a red flag when you get up at night more than once to go and pee. Yeah, irrespective of whether you drank so much at night or not. Yeah, but when you get up more than once at night to go and pee, it's already a red flag. Yeah.
Yeah, I also just wanted to ask about it. I wanted to say, so how is this constant urination or constant urination different from a normal person who is just drinking a lot of water? Because I believe that when we drink a lot of water, we also have this tendency to go many times to the bathroom to pee. But how is it now different from that?
Okay. It is different because, like I said, at night, not more than once. During the day, not more than 4 times. Okay.
Mhm.
Now, it is different because the one which is abnormal is always associated with other symptoms. For example, they will have that frequency which is constant going to urinate. They will have that urge to urinate, sorry, most of the times, okay? They'll have that urge. And that urge means what? When you feel as to urinate, you cannot control yourself before you get to the toilet. Okay. Normally, when you feel as to urinate, that urge to urinate, you are supposed to be able to control yourself till the time you get to the toilet. But those with diabetic and with other pathologies, but we are concentrating now on diabetic, they'll present
Diabetes.
on diabetes, will present with that urgency. Okay.
Mhm.
And then some may be associated with the force at which they urinate, the stream, the power is going to reduce. You go to urinate multiple times, but urinate with your urine will not come out with the force that normally used to come out before. And secondly, You urinate in small, small quantities, not in large quantities as you always do. Okay. And some may realize that they will need to push a lot before they urinate, straining. That is, they'll go to urinate. Normally, when you go to urinate, you are supposed, it's something that is a relieving something. When you pee, you feel good. But you see that with diabetic, you need to push harder before you want to even pee a bit. And when it comes out, most of the times it comes out in drops. And some will even tell you that, oh, after I pee, I feel like I should push my bladder before I remove all the urine from it.
And doctor,
Uh,
why is it happening like that?
yeah, it goes when that starts happening, it goes with the complication because diabetic is a systemic disease. It affects all the organism, if I may put it in that way. Okay, there are so many complications. The big complications, the ones that affect the big blood vessels, and ones that affect the small blood vessels. Okay, now with diabetic urology complications, it's both affect the blood vessels, which we call them vascular complications. I mean, affects the support of your urinary system and your bladder, as well as the nerve tissues, because the nerve tissues, they are what will make you to feel I'm pressed, I want to go and pee, because your bladder is distended and the nerves, they are irritated. Okay, once those nerve tissues are affected at one point in time, even when your bladder is full, you don't feel as to go and urinate. Yeah, and now all those sequence of events start stepping in, and as
Mhm.
the blood vessels and the nerve vessels, they are also impaired, it will make us in such a way that your muscles of the bladder, they will lose their force, their contractility. Because what is urination? Urination is that I go, my sphincters is like the tap of my bladder. Okay, they relax, and my muscles, they contract, they push out the urine. So you see that from the way the passenger and everything, when one of them, they are involved, they are affected by diabetes, it will prevent you from urinating. Yeah. So I think in summary, that everybody can understand, that is how, yeah, there's a lot deep in as far as the pathophysiology is concerned. But now I'm trying to bring it as simple as possible that even everybody, every layman can understand. Yeah.
Yes,
So
doctor, that would be great if you can
yeah,
really try to simplify it so that
yeah,
everybody can understand it, because this is not a topic that is familiar with most people. We don't come across such topics. So if you can
yeah,
really put it down in the simplest way, that would be good for us also. And you are
yeah.
really doing it well. Thank you.
Okay. So that's just it. Two things in mind. The blood vessels, they are being affected, and the nerve cells, they are being affected. So as a result of the diabetes.
The slow urine flow down.
Yeah.
Okay. No,
Okay.
I see some people, they are just coming in, they are saying greetings, hi, thank you, doctor. People, they are appreciating you from the comment section. I don't know if you can see the comment section also,
Yeah.
doctor.
Yeah, I
If you
can
can
see.
see and you see some questions, then maybe you
Yeah.
can answer their
Yeah,
questions
they are very
also.
interesting questions. Yeah, very
Yeah.
good. Yeah. So I will just, give a summary which will answer most of those questions. Yeah, a summary of how diabetes affect our urinary system. And if you listen keenly, you follow keenly, you see that most of your questions are being answered. Like I see, biggest fear is my kidney, and then yeah. So and all that as far as diet is concerned. So, like we said, how are the urinary complication of diabetes? The urinary complication, how would diabetes affect your urinary system? It is because when you have prolonged diabetes that's not being controlled, either by natural means or non-medical means, or medical means for those that cannot be controlled by non-medical means, that means prolonged uncontrolled diabetes is going to damage your nerve cells and your blood vessels, what I said, two things.
Mm.
And that's going to cause what? First, for the start, as a result, to respond to that injury, the bladder will start trying to force to overwork, over being reactive. That is, you feel like it's contracting because something is wrong. It's looking for a coping mechanism to solve that problem. That's why it starts by you going to pee too much because the bladder is trying. But after some time, when it's trying and nothing is being done, the muscles become weak. Yeah. And now, when the muscles become weak, it become underactive. It's no longer pushing. Like I said, nerves and blood vessels have been affected of the bladder. Now the bladder can get full without you noticing, having that urge to go and urinate. And by so doing, you have some stagnation of urine in your bladder. And when there's that stagnation of urine in your bladder, it goes now what to some sort of incontinence. The incontinence that you feel mostly in diabetic is overflow incontinence. What does that mean? It means that your bladder is too full at times. That is not being eliminated. The urine is not coming out. So it's like a locked container. When it's full, what happened? It looks for a place to go out. And by so doing, what we are seeing, most of them, they are feeling that leakage of urine is as a result of overflow of the urine. That's what is coming out. You understand? And now, when that urine now set in, it causes now other complications that we are going to talk about. There is a point for growth of bacteria. When the sugar, bacteria always proliferate. And then now, when the urine is there, it cannot go out. It's a source of infection.
That's true.
The bacteria will grow in the urine,
Mhm.
and by so doing,
To
those
pollute this.
patients they are prone to urinary tract infection. That's why diabetics they are always having recurring urinary tract infection. Secondly, once that urine stands, it's not going out normally as it's supposed to go because the force have been reduced as a result of damage of your blood vessels and nerve cells. What happens is that there will be backflow gradually because urine is looking for a way to go out. The kidney, the urinary system, just to summarize, is made up of the kidneys that produce urine and like filters urine. There are
Mhm.
two tubes that transport the urine from the kidney to the bladder. The bladder acts as a reservoir. And then now you have the urethra that when we go to pee, the channel, it goes out. So you see that if you cannot go out through the urethra, it will look for a way, a second option. Urine will start going back up from where it's being produced. Those are the kidneys. By so doing, you cause
That can damage the whole body.
yeah. So it will cause start by causing lower urinary tract infection, and when the
Mhm.
urine start going up, it will cause upper urinary tract infection. You always hear they'll tell you pyelonephritis. When your doctor tells you you have pyelonephritis, you should know that that's what he's trying to do. Okay, that is it. So
For you from Cindy Blanche. She
yeah,
says, Doctor,
mhm,
sometimes my urine is foamy in the morning, though not every day, but the foam disappear after some minutes. Is it a
yeah.
problem?
Overfoaming of urine could be a problem. It could be a warning sign. Most of the times, high protein in urine will present as overfoaming. And when you have your kidney, there is not supposed to be urine protein in your urine. When there's protein in your urine, it shows that the kidneys are suffering, and because they are suffering, they may reveal that as protein in urine because normally you are not supposed to have protein in urine. Yeah, your urine is going to is supposed to filter blood, okay, and reabsorb the necessary nutrient and send out the toxic waste and the unnecessary nutrient. When urine start coming out, means that during the filtering process, there are some of the essential proteins of blood that are being lost through the kidney, and it means the kidney is not is beginning to suffer. Okay, the basic cells in the kidney that filters blood, they are suffering. So urine are not supposed to foam a lot. Normal urine is supposed to be pale yellow. It's supposed to foam a little bit, not much. Yeah, yeah,
You are talking on that issue. Let me ask a question.
yeah,
So, when should someone with diabetic
yeah.
normally consult a urologist? Because seeing that if you start experiencing the leakage of protein in your urine, which is abnormal, but normally people don't have to wait until they start experiencing this protein in
Exactly.
their urine. So,
Yeah.
what are the signs for people, especially people that are struggling with diabetes, to know that now this is a red flag for me? This is time for me to go and visit a urologist. So, what are the signs for them to look out for?
Okay. Yeah. The signs for them to look out for is when you start having. Normally, before I say that, there are two specialists that will always manage urinary complication: the urologist and the nephrologist. Okay. The nephrologist most of the times will deal more of with the medical part. Okay.
And the nephrologist, who is that? Who
Yes.
is a nephrologist, please?
A nephrologist is a medical specialist that takes care of the medical complication of the urinary tract, mostly the kidney.
The kidneys.
Yeah.
Yes. Okay.
A nephrologist means nephron
Yeah.
from kidney. Yeah. So they are
Okay.
mostly with the kidney.
Okay.
Okay.
Thank you.
Yes. So most of the times, this diabetic patient is obligatory normally in a normal functioning system. Once you are diabetic, at least once or twice a year, it is obligatory to always see a nephrologist because the most common complication of diabetes is kidney failure. So you have to prevent before you attend to that stage. So that's why you have to see a nephrologist. He will tell you what essential are you to eat, what medications not to take, what medications they are healthy for your kidney or not
Mhm.
before time. Okay. So now they can start seeing most of the times they can see a urologist when they have that incontinence. Normally they should see a urologist. Yeah. But like I said,
If they are
even
just releasing urine, uncontrollable urine, if they cannot hold their urine.
exactly, they should
Mm.
see a urologist. If you are diabetic and you notice that your quantity of urine becomes small than normal, what is small? You should not wait for it to become small. Normally, your normal intake of fluid per day is supposed to be from 1.5 liter to 2.5 liter. Okay. So what you take in should be almost equivalent to what you send out.
Okay.
So you can do that because okay, I drink 1.5 liter of water today. I put a container each time I want to pee, I pee inside there to quantify it. If I notice that it's very small compared to what I drink and very concentrated, it's a red flag. As a diabetic, you have to see a urologist or a nephrologist, one of them. When the quantity of urine starts becoming smaller, and then also when you start having any pain, be it loin pain, you are not supposed to be pain at the lower level of your stomach, it's a red flag pain. Yeah, the lower level of your abdomen, sorry, the lower level of your abdomen. Yeah. Or pain around your flanks. It's a red flag you are supposed to see. Consult a urologist. Yeah, because it could be a warning sign of other complications. Okay. Yeah. And then yeah, so specifically for the others, you can see the other specialists, but for us, that one. And then that's for generally. For males, is one of the highest people we have for our complications. Most at times, there's never a day that I will be on consultation. If I see 20 patients a day, at least I must have five of them that will come, or six that will come because of, or seven even that will come because of sexual problems or erectile weakness, sexual weakness, as they will call it in the law, in our normal time that we understand. Yeah. So most at times, if you have those problems, you need to see a urologist. Okay. Now, if you have, you cannot know whether you have kidney stone or not unless it's been diagnosed. But
Unless
that
it
is
is
one
under
of,
control.
yes, but that's one of the common complications. Diabetic patients are prone to have kidney stones. Yeah. So that's why I would say
How
if you
can
feel,
they know? Are there some
how can
signs
you
that they
know? How can you know? They'll always present with what? You urinate that is at least maybe stained with blood. They'll tell you they pee with blood or stain that urine they are being stained with blood. They'll pee and they'll
Mhm.
see drops of urine, especially for women that they are not during their menses or around because it could be urine from menstrual flow. But when you urine that is stained with blood, burning sensation during urination, you pee and you feel some burning sensation, pain during urination, okay? And plus or minus flank pains. That's why I talk about flank pains. If you have flank pains, you have pains at the lower level of your abdomen, you feel pain during urination, you feel that burning sensation during urination, and then you have inability to retain your urine, all those are warning signs to see a urologist. Okay. Yeah.
Doctor, I believe those are common signs that people may overlook because some people they may even experience they may take them for something else and they will not even think, okay, maybe this is a time for me to visit a nephrologist or maybe a urologist. But you've talked
Yeah.
about it now, so everything is made clear. But I want to ask you this question also because
Yes.
many female they
Yeah.
tend, especially those who are struggling with diabetes, they have this. They are common to have urinary tract infection.
Good.
So, it's something that really affects women. So,
Mm.
what can the women do to reduce this problem? What
Okay.
can be done for them to reduce this problem and to take control over their bladder?
Okay. Simple things first. Women they are prone to why are women prone to urinary? All women in general, and it's more higher in diabetic women. Why are they prone to us? The first thing, nature. Women have a short urethra than male. The urethral, the last part, like I said, from the bladder to the out. Yes. For women, it's 5 centimeters long, 5 to 6 centimeters. Very short, very short. But for male, it's right up to 25. So you see the difference.
That
That's
can
why
even be
women,
the cause why women are more prone to urinary tract infection than men than.
men, the first cause is the shortness of the urethra. The second cause is the proximity of the urethra to of the urinary system, the urethra to the anus. You see, it's different. So it make in such a way that there's easy way for bacteria to migrate from the anal region to the urethra and cause ascending infections. Ascending route, that means the bacteria they can migrate there, they come to the urethra and then they go up gradually. So that's why you see they have the risk factor first of all because they are diabetic. They have another risk factor because urine is stagnant there, it's not going out, which is a so and then they have a short urethra and then anatomically their anus is close to their urethra. So you see, those are all the causes. Now talking about the causes, that's why they are more prone. How can they help to reduce? Because that's what is more important. How can they help to reduce? First, the functional method is proper hygiene. We start with first things first. Yeah, proper hygiene, how to change good undies, clean the undies with normal soap and water, not complex detergent, and make sure they always iron this. Their underwears, women
Always
change.
iron them, doctor.
Eh?
So we have to iron.
It helps. It helps. Yeah, it helps because you don't know the source of your water that you use and all that. That's why we always advise you iron your
Mhm,
underwears. You wash
mhm.
them with normal soap, savon. You iron them.
That's a
So,
good one. That's a good
yeah,
one.
it's very
Mhm,
important. Hygiene, constant
mhm.
change and ironing and all that. Cleaning. The woman should always clean from before backward. Most women they make that error. They clean anyhow. Yeah. When you clean from behind to in front, what do? You
You
carry
carry.
micro from the anal region to the vaginal canal, and you can. So they should learn them to clean from in front backward. Okay.
But we are in the house, so I
Uh,
hope we are learning. So we are
yeah.
learning hygiene, basic hygiene here. Oh.
Basic hygiene is very important.
Yes.
And then
Mhm.
they should urinate frequently when urged. They should not keep urine for long. When they feel has to urinate, they should go and urinate. They should not stay that, oh, yeah. When they feel has to urinate, they go and
But
urinate to
doctor, I
help
used
them
to have
always.
this problem for me. Like when I have that urge to go to the toilet, I'll say, let me not go direct. Let me
Yeah.
train my system to maybe keep it a little bit. Let me not just go because I felt an urge to go to the toilet. To me, I'm thinking like training my system not to always go to the toilet. So is that good or it's not good?
Not to always go, you train like for a short period of time, you want to walk because that's a form of treatment as well. You call it pelvic muscles exercise. It depends. It's good. But keeping it for longer time is not good. You have kept it more than 30 minutes, more than 20. No, it's not good. But if I say so that I want to contract because it's a form of therapy, it's good. We'll talk about it. Yeah, they call it pelvic training. When you feel has to pee, try to see if you tighten your pelvic wall, you understand? Yeah, so that you can tighten it for some time to have control over it. It's a form of training, but not keeping it for long. Okay. Yeah.
Okay.
So those are the basic measures, and also avoid using public toilets. Those are also risk factors of urinary tract infections. Now, for the medical means for these women who are always having it, for the non-medical means also, we have talked about it. Dietary measures, reduce sugar as much as possible. Okay, reduce processed food as much as possible, because all those ones are risk factors.
Mhm.
Yeah, reduce sugar, reduce fizzy drinks, reduce processed food. Those to all those ones. Okay, avoid urinating of drinking water during bedtimes. Just make it that after 8 you don't drink, because what would I do? That they'll increase production of urine during that period, during sleep period. It will cause you a lot of irritation, because you might be forced, even if you are going up at night once or twice. But after drinking much water during bedtime, it might increase, which is not always good. Okay, so that's it. Um, Basic measures, medical measures now. Normally, how to prevent it, we'll talk about preventive. It's just preventive. Yeah. Now, when you already have the
Okay, so
symptom,
I have a question here.
yeah,
All
yeah,
Oyoma says, I am now pre-diabetic, previously diabetic, and
yeah,
treated for prostate cancer by radiotherapy, but still go to urinate 3 times at night. Is
yeah,
it the diabetes or the treated prostate cancer by radiotherapy?
yeah. You can't really tell it, because it's a vast, his case is complex and different, because we can't really tell if is a diabetic. If his blood sugar is being controlled normally, is between the normal range, that means his fasting blood sugar is less than 120 milligram per deciliter. Okay, his fasting blood sugar, if it's within the normal range and he's still going 3 times, then the complication should be from the prostate cancer, not from diabetes, most likely. Okay, and you should also know that he had radiation therapy, and radiation therapy at times cause what they call radiation cystitis. That means inflammation of the bladder walls due to radiation. That means the treatment, it treats the cancer, but it also has its complications. Yeah, that one must have been discussed by with him, with his doctor. Radiation cystitis. That cystitis might cause you those maybe frequent urination and maybe some pains and all that. Okay, so his is probably due to side effect of his radiation therapy, most probably. Yeah, most probably. If other factors are being eliminated, then yeah.
Cindy says, me holding my urine now because doctor said it is a red flag not to pee more than twice a night.
No, it should just be spontaneous. You shouldn't be in your mind, eh? It shouldn't be something that, oh no, I don't want to. But if you feel that urge constantly,
Mm.
it's a red flag. Okay, yeah,
Yeah, she's also asking for the signs of urinary tract infections for women. Now, what are the
okay.
signs?
Good. Signs of urinary tract infection. Generally, we have two. We have lower urinary tract infection and upper urinary tract infection. Okay. For the lower urinary tract infection, they will always have frequency. That means you go to urinate more than 5 times a day during the day. You might have nocturia. That means you are going to urinate more than 3 times at night. You might have pain during urination. Okay. You might have burning sensation when you urinate. Okay, those are the common signs of lower urinary tract infection, talking female and generally, but mostly in female. Yeah. Now, depending, rarely you might have urine that is stained with blood, but most of the times when urine is stained with blood, us as urologists, we don't. It's always a red flag. We don't always look at it just as urinary tract infection. We go to look for stones. We go to look for cancers. We go to look for other things. We go deep. But the basic ones, pain during urination, burning sensation during urination, frequent urination more than 5 times a day, frequent urination more than 3 times a night. Okay, there are signs of urgency also. Urgency means I feel as to pee. If I don't go, I may wet myself. Yeah, those are signs of urinary tract infections. For lower urinary tract infection, upper urinary tract infection now, most of the times will present with side loin pains. Like I said, either at the left or the right side, and most of the times they always present with fever. Fever, yes. When you have those loin pain, fever, and urinary irritation, upper urinary tract infection, until proven otherwise. Yeah.
Treatment. I got a question here from Ivo. He said, "What are the consequences of surgery?" I believe.
Now surgery for what?
Yeah.
It depends. Now surgery for what is vast, because it depends. Surgery would depend. Is it surgery for the bladder? Is it surgery for the kidney? Is it surgery for the prostate? Is it surgery? So that's it. But to summarize, surgery is always the last option. Us at medic, even I as a surgeon, I always tell you surgery is the last option. Any person that enters and he will just tell you this is only surgery means the doctor does not really, the surgeon does not know what he is doing unless he is going to explain to you the indication. But in many cases of urinary pathology, surgery is always the last option. Yes, unless there is an absolute indication of surgery. Yeah. Urinary tract infection is always medical treatment and non-conservative and conservative management. Okay. But now other complications like maybe kidney stones, like I talk about urinary stones, depending on the size, depending on the location, depending on the associated complications, it could be medical expulsive therapy or it could be surgery. Medical expulsive therapy means what? Medications that, if it's very small, the location, they can give you some medication to try if you can pee it out. Yeah. But if it's very big, it's stopped. Most of the time, it's surgery. Why? Because it's blocking the passage. Urine will build up, and that's what will cause you kidney failure. Yeah, that's what will cause you kidney failure. So it will depend now on the type of surgery that I can know, the type of complications that I can give. Every surgery has its own complications.
That's
Yeah.
right.
So generally,
Doctor, before I ask you my next question, let me ask you two questions again from the comment section.
yeah.
Christy says, "My blood sugar is most of the time normal. I urinate more 3 times at night, but not more than 3 times during the day. Is
Mhm.
that normal?"
Now, is there more 3 times? Normally, it's not normal. Yeah, it's not normal. There are a lot of you shouldn't two, yeah, two borderline, but three, no, it's not normal. Your blood sugar could be normal, but now go and check. Maybe it could be you could have a cystitis. What's cystitis? Irritation of the bladder. It's a type of lower urinary tract infection that hmm, that cause inflammation of the inner walls of the bladder. That could be infectious or it could be non-infectious. Yeah. So it could there's something wrong if you are urinating 3 times a day. Yeah, should go check basic.
Please, how many times is normal to urinate at night and day?
Yeah, I already said it. I say at night you shouldn't urinate more than once at night. Maximum two, twice. During the day you shouldn't urinate more than 4 times. Yeah, yeah, you shouldn't urinate more than 4 times during the day. Yeah.
Okay, now, doctor, let's go over to the men. When we talk about men, the first thing that we want to talk about men, we talk about erectile dysfunction. And erectile dysfunction is something that most men normally experience, but most often we tend to look at it in men that are struggling with diabetes. So we tend to associate erectile dysfunction to diabetes. But is there a possibility that men can also experience erectile dysfunction as a result of the urinary tract problems?
Okay. Uh Erectile dysfunction is a whole, I can say, it's a whole big, broad topic on its own. That people even go to specialize for 3 extra years only for that. Yes, go for 3 extra years just to specialize only for that. So it's very vast. Now there are five components as far as erectile or sexual weakness is concerned. You have the psychogenic component of it psychologically. That's why when somebody is stressed, somebody lost job, somebody loss of a loved one. I'm talking mostly to us men, because to the women it's difficult to know. They also have theirs, but men it's always obvious because what we are the ones to have the erection. So even if when you have the problem, it's visible. If you can't sustain, it's so visible. Women can have their own sexual disorders, but it's not really visible unless they say that. But men, it's visible because you can't sustain an erection. So there are 5 components. You have the psychogenic, you have the physical, and tactile. That has to do with nerve. That's why when you physical, when you are being touched, you are being aroused. That physical component is there. Okay. You have the metabolic component, which comes with diabetes has as a complication. That's where diabetes fall as a complication. Okay, that has to do with your blood vessels have problems, or your nerves, nerve system, neuron have problems and all that. Okay, and then you have the neurological component of it, because what is erection? The penis have just big vessels. Once blood flows, there are great vessels. Once blood flows there, it becomes rigid and the penis gets up. Once it contracts, the blood goes back and the penis falls. So you see that if those blood vessels have problem, you have erectile problem. That's why the vascular component. Okay. If they are the nerves that they are being stimulated, they are touched, you have erectile problem. So basically, those are those 5 components: psychological, tactile, vascular, neurological. Okay. Now, diabetics. We are talking about the diabetes. How would diabetes cause it? Because there's
Asking because most often when people talk about when
yeah,
people have diabetes and they talk about erectile dysfunction, we always think that it is associated with their diabetes. So my question is
yes,
it possible? Is it possible also for erectile dysfunction to be caused by urinary tract problems,
yeah,
by urologist problems?
yeah. It is.
Yeah, that is my question. Yeah.
Yeah, it's possible. It's possible, and the urinary it's very possible, because if you look at all these causes that I've said, anything that will cause, like the prostate, for example. Hello, hello.
Getting you,
Yeah,
doc. Mm.
yeah. Anything that will cause an obstruction of your urinary tract in male can affect your sexual function. Okay.
Okay, that's good. That's what I wanted to hear.
It can, it can, it can. And in male, the most common cause is the prostate. Is the prostate.
Mhm.
Once your prostate is enlarged, for so many reasons, you see that it goes hand in hand with sexual weakness and all that. Yeah.
Now that
So
you're talking about prostate, there is a question here. Hello, doc. What are the symptoms of prostate cancer and how can we avoid it? Can you talk about that? Can you throw some light to that, doctor?
I will just throw some light. Prostate cancer is one of the most complex fields of urology. It's one of the most
Mhm.
complex, yeah, fields of urology. All urologists will tell you that prostate cancer is a nightmare,
Mhm.
because yeah, every day there's research on it and all that. To say the causes of prostate cancer, you can't say prostate cancer has a cause, but we have risk factors. There's no cause, but there are risk factors. Risk factors means factors that when you have a higher probability of developing it. Yeah, but there's no particular cause pinpoint that this is a cause of prostate cancer. Yeah, and you could have some symptoms, and as well you could be asymptomatic. I've had a patient of 29 years that had no symptoms, but he came to consultation. I had him. Yeah, that's the youngest I've had. 39. No, 37. Sorry. The youngest I've had is 37. Can you imagine? It's a 37-year-old with no symptoms, and he came with that is stage 4 prostate cancer, but he never had any symptom. Yeah. So prostate cancer could be asymptomatic. That's the first point. It could present without any symptom. That's why they say it's a slow killer with a progressive evolution. You cannot have any symptom of it. Secondly, you could have certain symptoms, like symptoms of urinary tract. First of all, frequency, peeing too much, okay, urgency. Most of the times, the highest red flag is hematuria. That means blood in urine, blood in urine, blood in urine, massive hematuria. Most of the times, those are the most common symptoms of prostate cancer that we see. Blood in urine. Okay. And then some of them might come with urinary retention. Since it's something that is asymptomatic at times, most of them they'll present when they are unable to pee. They want to pee, but the urine cannot come out, and you see them, their bladder is really full. So those are some of the symptoms. You reduce stream of urine, that means the force of urine may reduce. But they interplay because some of those symptoms, they can just be a symptom of just an enlargement of the prostate rather than a prostate cancer. That's why I say it's really, really a nightmare because it must not be prostate cancer. You could just have a benign prostatic enlargement. Yeah, not necessarily a prostate cancer. Okay. So to throw light on the risk factor is age. Age is one of the risk factor. Normally, those who are above 55, they are risk than younger people. Okay.
Okay.
Secondly,
Is
yeah,
there a test that they can also do? Is there a test for them?
yeah, there's a test. There's before I come to that, you have race. Us African blacks we are higher risk than whites. We have more prostate cancer than the whites. So being a black already, you have a risk factor of prostate cancer compared to a white or a Chinese. Okay, so that's why I say there's no cause, but there are risk factor. Risk factor of prostate cancer in the family. If your father had prostate cancer, you are more at risk. They are not supposed to wait to 50. From 45, they have to start screening you for prostate cancer if your father or your uncle died of prostate cancer. Okay, that's another risk factor. Breast cancer in the family. If your sister had breast cancer, you as a man, you are at risk of having prostate cancer. So it has to be screened. Yes. Yeah. Very, very high risk factor. Okay. Pelvic uterine cervical cancer is also a risk factor for the male. If your sister or your mother or your first degree relative had cervical cancer, you as a male, you are at increased risk of developing prostate cancer. So those are some of the risk factor. And then smoking also is a risk factor. Okay. And so others and so others. Then now genetic composition, there are some genetic factor, some genes that have been identified which are long. There are some gene BRO1, those are complex, but genes that those people who have that gene, there are more than 50% chance that they'll have prostate cancer, and theirs is always very, very aggressive. Yeah. So that's just a summary of what I can say. So the test that they can do most of the times, they'll call it screening. There are some tests for male more than 50, they'll tell you go and get your PSA check, prostate specific antigen. It's called PSA. Yeah, that's the most common one. The PSA. When it's high, generally, just say when it's more than 4, it's a red flag. You are higher risk of prostate cancer. Okay, even though there are other causes that can make it to risk. So that's the common test that we have, the PSA. But you have to know that there are two things. The doctor have to examine you, do a rectal exam to examine your prostate to see if it's normal or not. Yeah, and so on. So I think that's it.
Very much. That's
Yeah.
wow. That's wow. At least we are all learning because to be honest with you, I've learned a couple of things. Yes, things I thought I knew, but I'm getting to know much about them now. But let me ask this question also for people that are having problems with their bladder issue. I know you've talked about this, but I want to ask it in the form of a question so to make it more clear to those who want to have answers to them. If you're
Mm.
having issue with your bladder, is it compulsory for you to go in for surgery, or are there other ways that you can treat these bladder problems? For instance, like using lifestyle, maybe with your diet, exercise, or just doing something, but treating these problems without necessarily having a surgery. Is that possible?
Yeah, that's possible. Like I said, surgery is always the last option.
Mm.
Surgery is the last option. Yeah. There are other non-medical methods of management, lifestyle modification. Okay, regular exercise, the exercise that suits you is very important because why? When we do exercise, jogging, running, and all that, squatting and all those type of things, they help. They improve blood circulation. Okay, and they improve the functionality of the muscles of the pelvic wall. So lifestyle, exercise, very important. Could be movement, it could be walking, brisk walking, it could be running. Lifestyle is first. Then now, others like what you say, uh, um, bladder training, like what you just explained. For some people who have that, you try to see how you can control by holding tight your pelvic muscles, like the same thing you do when you want to force, when you want to stool. It's the same thing. You try to tighten it to hold. From time to time, you tighten it and you see if you could do. By so doing, you are contracting and relaxing the muscles of your pelvic wall. It helps for some of those complications. Non-pharmacological management, non-medical management, they improve a lot first. Okay. Lifestyle
Yeah.
management, diets. I already said it. You take diets that will help you to lose weight as much as possible, because most of these things they come as a result of complication from obesity. There are most of us we are obese, but we don't see. We think that only the ones that are very fat that are, yeah, the thing that know they are the other. Yeah, to know if you are obese or not, even through the internet, you can know. You go obesity calculator, you take your height and your weight. There are places you enter your height and your weight. It will give you whether you are obese or not. And once you are obese, those complications will set in. So you take diet that will help you to lose weight, okay, especially truncal obesity that is around your abdomen. Very important because most of them cause those complications. Okay, yeah. So that is it.
And then
Other
do you
non-medical.
have maybe some natural foods or African herbs that people can use to prevent all these urinary tract infections? Anything for them to be eating more often?
Yeah, yeah, natural food like our natural, like I've said, processed food, avoid sugary food, more of water, more vegetables, yeah, more vegetables, yeah, whatever, but avoid vegetables that contain a lot of sugar, yeah, like a lot of sugar. You eat them with moderation, because when they say more vegetables and fruits, somebody will go and eat so much papaya and all that and melon. It depends, eh? Yeah. It's very difficult to quantify with respect to grams and this. But just take your plate of food, you divide it into 5 portions. Okay. Yeah, maybe 3 feet of that portion should be vegetables. Okay, 1 feet should be protein. Okay. And then maybe less than 1 feet should be carbs. Very small carbs because your cells need them as well. Yeah. And then the rest fruit. That's the easiest way that I can always say. I take your plate of food, you divide it into 5. Yeah.
Mhm.
3 feet of it should be vegetables. 1 feet of it should be proteins. 1 feet should be fruits, and then the smallest portion or 1 feet should be carbs. Yeah.
And when you are talking of carbohydrate this time, do you talk about simple carbohydrate or you are focusing more on the complex carbohydrate then? Or it doesn't
Oh,
matter?
uh, I think of simple the ones that we have in our day-to-day food. Yeah, because I think those are just the ones that they will be accessible to most. Yeah. So yeah, and then that is just it. And then there are certain food stuff to avoid or to reduce. Okay, certain food stuff to reduce, especially with those urinary problems. Mostly in males, even females they can. Like you reduce the coffee consumption of coffee, you reduce the consumption of tea, pepper, tea. You reduce if you have urinary disease. I'll explain why. I've not
Okay.
saying stop. I've not saying stop because some people you really reduce. Like me, I love coffee a lot because I work a lot, but I have to reduce it because it's also something. Pepper, you reduce. Spicy food, you reduce. Why do I say so? Alcohol, better, you reduce. Or if it's possible, you stop because I'll tell you the complications are so enormous. Smoking, for those who smoke, that one you stop because it's horrible. Now, why do I say coffee, tea, and that? Those are the increased bladder emptying.
Ah, yeah, yeah, that's true. Yeah,
Yeah,
yeah.
the increased bladder emptying.
Mhm.
So you understand
Mhm.
because you are treating not only the symptoms, but you are improving as well the quality of life.
Mhm.
Imagine if you could help somebody not to get up so many times a night to go and pee.
Mhm.
So you realize that the day that you don't drink coffee and tea, you will not pee too much at night.
No,
Oh,
that's
yeah,
right. That's
yeah. So
right.
you are improving as well the quality of life. All those things I named, they are bladder irritants. They improve bladder emptying. So when you reduce them, you put your bladder at rest. Yeah.
Very much, doctor. Thank you.
Surgery is the last option. If you do all of these things, they don't work. Now it will depend if it's somebody who is having frequent retention and all that yourself, because that urine cannot stay there. The urine cannot stay there. Clean, to put a clean catheter to empty yourself. For those that is non-medical antibiotics to treat if there's a germ that we have identified. We don't just prescribe antibiotics like that. If I do a urine test, I see a germ, I'll prescribe antibiotic to treat if there's a germ. If you have done non-medical management, they don't work. There are medications that will provide that helps to tonify the wall, the muscles of the bladder, so that you can empty it. That's when we go to medical management. There are a lot of medications that we prescribe for that. Okay. If that doesn't work, or the person is still having retention and all that, there are other methods that we can do to catheterize the bladder and all that. Okay. If that doesn't work, we go to the next step. Okay. There are also other medication or substance that we can introduce to the bladder and all that, okay, to help it gain its tonicity. Like I always say, surgery is the last option. So you see the steps that we are going only to avoid surgery, okay? If that doesn't work now, it will depend on the severity. Yeah, severity. But if it's one that one can cope with, we'll always
You
put
can
surgery.
manage. Mm-hmm.
Yeah, surgery is always the last option. But if that doesn't work, like somebody who has incontinence all the time, they have looked for all the problems, but is always having incontinence and all that, and we identify the problem. Medical management cannot work and all those ones. Okay, now they can go some surgical intervention. Now this surgical intervention they depend on the pathology. If it's for continence, there are always some slings that will put at the level of the bladder neck to help tonify the bladder neck. Okay, that's just it. Yeah, they always call them sling to make you sure that yeah, it's an artificial. So surgery is the last. Yeah, yeah,
Talking about incontinence, so I wanted to ask, can high blood sugar level cause a person to be incontinent, to urine incontinence?
yeah. In the long
Mm-hmm.
run, yeah. From what I explained,
Yeah.
yeah. When you will call it a neurologic bladder. Once high blood sugar, prolonged use, long high blood sugar not being managed, it will cause the nerve cells
Mhm.
of the bladder to be affected. And when they are affected, they will not be able to contract. And when they will not be able to contract, they will not be able to function properly. And urine will stock there. And at times when it overstocks, okay, it can flow out as overflowing continent. It can also affect the nerve supply to those sphincters that they might not be able to contract normally to block the urine outlet. And the person might have incontinence. So it can cause.
I saw a question here. I don't
Mhm.
know if that question is meant for you.
Yeah.
The question says, wait then.
Mhm.
When you are told your vitamin B12 is too high, what can be done to bring it normal? If you have a high vitamin B12, most often I hear people have low vitamin B12, but now this person is having a high vitamin B12. So what can she do to bring it back to normal? And
Um,
what is even the cause of having this high vitamin B12, doctor, if you can answer it?
um, most of the times when people have high vitamin B12, most of the times it depends. It could be either a problem with absorption, because most of those vitamins, they are as a result of absorption for what we eat them. Yeah, you could have a form of absorption problem most of the times. So most of the times it's dietary restrictions. Yeah, it's dietary restrictions. Now, is it associated with other vitamin deficiency or other vitamin? Because we cannot just say you have vitamin B12 very high, go and take this. No, we don't look at it like that. We look at the other complication or other associated factors, and then it's being managed holistically. Yeah. So that's how we look at it. Is the vitamin B12 just alone, or is associated with other vitamin deficiencies? Then now we look for the cause and we treat, because at the end it's treating the cause. Yeah. Vitamin B12, high vitamin B12 is just maybe a symptom, eh? Yeah, a symptom. But at times, okay, vitamin B12, you take this. No. What is really the cause? Was it just the vitamin B12 or the way associated stuff that we're giving? Most of the times it's dietary restrictions. Yeah, or dietary supplements. Most of the times.
I hope you've gotten your answer.
Yeah.
There's another question. Could lack of irregular sex cause prostate cancer?
Ah,
Doctor.
that one, that one is a strong debate that up to now, eh? Yeah, us urologists, there are two school of thought. There are very two school of thoughts. Yeah, yeah, because before there was a first school of thought that says that um regular sex can prune, but the recent study that was done, I think it was in Swiss, multi-systemic studies that was being done, the trial, it proved that regular. What do we mean by regular? When a urologist say regular sexual intercourse means at least three sexual intercourse a week for males. Mhm. Average at least three is considered regular. At least, okay. Yeah, it has some sexual. It's not really sexual intercourse. It's the aspect of ejaculation. To to be honest, because you can have sex, you don't ejaculate. If you don't ejaculate, it doesn't have anything on your prostate health. The prostate health is what, if you could have sexual intercourse and you ejaculate frequently. When you ejaculate, the prostate gland is being active. It has some protective effect on the prostate. Yeah, that's the recent one. But there are some studies that they are against. So you can't talk about sexual intercourse and prevention of prostate cancer, but you talk about ejaculation and prevention of prostate cancer. Yeah, if you have at least three intercourse during which you ejaculate, okay, per week, it it has some protective effect on the prostate. Yeah, yeah, it has, compared to, because it was a case control studies. They took those who did not have for a long time the biopsy series, and they took those who had regular, that is at least three times or more a week, and they had to analyze. The numbers were more with those who had less than that three per week compared to those who had regular. Yeah, yeah. So that is just what I can say generally, but I cannot say that regular sexual intercourse will prevent. No. Yeah,
Prostate, no.
yeah, yeah. Because anything in medicine should have scientific backing. Yeah, it should have scientific backing. If not, then yeah. So, but there have been studies that have been done, and that show that when you have regular sexual intercourse, it protects the prostate compared to those who don't have. And that regular is regular ejaculation. Ejaculation, yeah. That regular is at least three times a week. Yeah, yeah. It's adequate.
Men 3 times a week.
Yeah, it's
Mhm.
adequate. At least, so if
If you
if
want
you
to
can have it so
keep
many
yourself
times, oh,
clean,
that's
if
your
you want
problem.
to prevent it at least 3 times a week, then you're on the safer
Yeah,
side.
yeah,
Doc,
yeah.
this one you are saying, our husbands they will kill us now. They say the doctor told us that we should do it at least 3 times a week.
Yeah, yeah, yeah. So yeah, that's how they call it, adequate exposure. Yeah. So
This EM is all this they tell us women and for the women
eh,
and for
for
the
the women,
women.
for the women it's also important, but I can't really tell because the gynecologist will tell you more. But for the women, it depends on how you take care. I can't say required time. I can always say for the men. I'm like the
Yeah,
male gynecologist.
Yeah,
So
it's
I say
okay,
most
Doc. I
of the day,
understand you. Thank you very much. I understand.
yeah,
Doc, I have a question. So, what tests or checkups does a urologist usually recommend for people over 40 years and those people are struggling with diabetes? So,
diabetes.
which tests or checkups do you recommend for people above 40 years who are struggling with diabetes?
Okay. Above 40 years, there are some
Above
basic
40 years.
yes, there are some basic tests to do. I call them basic that you are supposed to do. The first is your fasting blood sugar. That should be a normal thing that you are supposed to be doing it at least every week, at least 3 times a week. But the most important one is glycated hemoglobin, because glycated hemoglobin is the test that would determine exactly if your blood sugar is being controlled or not. It measures the quantity of sugar that is being bound to our red blood cells, to hemoglobin. Yeah, the HA1C,
Yeah,
HbA1c. Yeah,
yeah.
that is the first. Second is the complete blood count. Complete blood count will tell you if your blood cells are normal, your red blood cells are normal, if you are anemic or not, if your white blood cells are normal, because white blood cells will tell you if you have infections or not. Okay, if your platelets are normal, they'll give you an idea whether you are having some bleeding problems or not. Okay, if there are any infection, we'll see it in your white blood cells. Okay, so it's very important. The third one is your kidney function test. Kidney function test is always urea, creatinine, and then renal clearance. It's very important. It will tell if your kidneys they are functioning normally, optimal, or suboptimal. Very, very important. Once once they are high, it's always a red flag. Shows that the kidneys are suffering. So urea and creatinine, most especially serum creatinine, because creatinine will tell you most likely. Yeah, they always say creatinine level more than zero point 0.1 or zero point 0.2 above the normal level tells you that there are so many millions of nephrons that are already being destroyed. So you see, it's very important. So your kidney function test. Now, your lipid profile. What's lipid profile? They are normally the lipids that we have in blood, and there are two types, broad types to simplify it. They are the good lipids and they are the bad lipids. Lipoproteins. Lipid profile, they'll measure the lipoproteins in blood. So you have the good ones that protects the heart and protects us from cardiovascular risk factors. Okay. And then you have the bad ones, bad lipoproteins. I'm just summarizing it, that expose us. Okay. So they have to measure them. Okay. And then urine analysis to check if there's any infection and all that. Yeah, urine test to check.
But
Now,
doctor, sorry, these tests, can they be done at home or they must go to the hospital, to the lab to do all these tests? Are they common ones for them to run
for
them
the
at
one,
home?
the only common ones that you can do at home maybe would just be your fasting blood sugar, and then maybe with your urine analysis. Those ones you can do at home. Okay. And then your urine but now companies have come out that they have make some caskets that you can always read. Just read it. If you can do them at home, if you can interpret them, good and fine. But if not, most of them they are always like the kidney function test, the liver function test is important. Those ones are in the hospital. Yeah, yeah, yeah. But the
Oh,
sugar and urine analysis, those ones you can do them at home. Yeah, to check if there's in your urine, to check if there's any infection in your urine, to check if there's blood in your urine, and all that. To check if your pH, your urine pH is normal, because it will tell us a lot of things. Yeah. So those are the basic ones that I think should be done.
all
Mhm.
right, thank you very much, doctor. I have my last question, and then we can just go through the comment section before you give your
Okay.
last word. Yeah, but my
Okay.
last question for you, doc, is this. It still goes to the men because most men with
Yeah.
their erectile dysfunction, these people, they don't like to talk about it. You know, sexuality or sex something is thing people don't always like to be open about it. And we have our men struggling with erectile dysfunction, but they don't want to talk about it. So what is your message to these men? What is your message for them to stop them, to make them not to feel embarrassed or ashamed of their problems? So what can you advise them?
Yeah, it's something very difficult. Like I would say psychologically. Yeah, I'm talking like a man and not like a doctor. I always put myself the position of the patient when the patient is in front of me. I always put myself in that position. It's something very difficult. But the first thing you have to know is that you have to open up, especially with your partner. That's the first thing. You have to open up. They have to know that it's not a taboo, because that's what will always kill us. Because it's like a vicious cycle. The more psychologically you are disturbed, you feel down that, oh, I'm not going to perform normally. I'm going to be looked upon like a weak person. The more it becomes more serious, because that psychological aspect of there is not working. So the first thing is to have an open mind, like I always say, to always discuss it with your partner, because most of the times the partners can help to improve the situation. They always help. Yeah. Yes. You have to always discuss it with your partner. Have to open up with your partner first. Yeah, so that you should know that it's not something like that. But it's something that happens, eh? It's there, so many people. So when you can break that psychological barrier, it's already a very good step. Okay. Secondly, now you go for checks, because most of the times we might identify the cause and we treat. I will tell you that 90% of men with with this sexual is psychological cause, is psychogenic. I'll tell you, 80 to 90% is psychological. The cause is psychological, is psychogenic. We have just about 10 to 20% that they are those other cause, metabolic cause, diabetes, and all that. But I'll tell you that the other 80% is psychological. Yeah. So if you can break that psychological barrier, yeah, you're already on a good footing. You can be able to discuss with your partner. You're already on a good footing, because I know it's a very difficult thing, eh? Yeah, but you have to know that, yeah, it's already good footing. Go checked. If there are any, be it infection, be it diabetes, be it prostate related problems, because those are the most common causes, apart from psychological causes. If there are problem with your lipids, lipid profile, like lipoprotein, that's why I said it's very important. If you have any lipid abnormalities in your blood, there are medications that will be prescribed to bring them to the normal level, and then you can pick up from there. So that's it. Yeah, that's the advice I can give. Yeah, and also involve in social support groups, because you know that people hearing stories like, yeah, for example, getting people's stories and all, they feel more motivated. They work a lot with their psychological health and all that, and it helps. Mhm.
That's true. Wow.
Yeah.
Thank you very much, Doctor. So let's hear from the audience. Please, if you have questions for Doc, just drop them in the comment section. I had a couple of them here, Doc. Somebody was insisting, but I'm looking for the
Yeah.
question. If I
Yeah.
see it, I'll ask you. But let's take this question. Somebody said, even if you take much water, can that not make you to pee much? Like 1.5 liter to 2 liter waters of day per day. Can it not make you to pee much? That's a question from somebody.
During the day, but not at night. Like I said, if you took it before, if you took all that before bedtime, you can pee 4 times during the day. But when during the night, it's a red flag if you start urinating, because that's your normal requirement, 1.5 liter at least for an adult.
Yeah.
Yes. Yes. When I was in the northern region, in Cameroon working, there are patients that come, they'll tell me they drink even up to 4 or 5 liters. I understand, because
Wow.
it's very hot.
But
Yes,
yeah, that's
it's
true.
very hot. And there are days that I drink up to 4 liters, because it's
Jesus.
bad. Yes, because I'm trying to protect. It's much, but I see that I'm feeling so dehydrated and my kidneys are at risk. So I had to really hydrate myself. So,
Yeah,
but
yeah.
if you take 1.5 liter, 2 liters, yeah, pee 4 times a day, maybe 1, 2 times a night, but no more. Yeah, yeah. Yeah.
Lindsay, can you drop your question again, please?
Yes, I saw another question. If there are foods that one can take that can prevent prostate cancer, like I
Ah,
said,
voila, yes.
yeah, I said, um, studies not really. There are food that they can avoid. It's just like avoid processed food, all this charcuterie, all these sausages and all that. Those are very dangerous. They are cancer causing food. They are around number two. They are very high index of causing cancers. Okay. Yes, they are cancer causing agent. All these processed meat, all this process, they are very dangerous. Yeah. They are still there in the market because politics always play with all those type of things and all that. But I'll tell you, they are very cancer causing. Uh Processed vegetable oils, all those things, they are at high risk as well. So I go now back to your point. Us eating our red palm oil and all that is more protective, to our organs, yeah, than all these ones. They are more protective. Yeah. So like a food that can prevent, I don't think there's a food that can prevent, but you better prevent the food that can increase your risk factors. Yeah. You should prevent the food that can increase your risk factors. Foods high in lipids, processed food, processed meat. Yeah. Just avoid them. Yeah. Yeah. That's the highest way that I can see you can prevent. Prevent is by preventing the risk factors. Those who are smoking, you prevent smoking. Alcohol, avoid it because those are all risk factors at prostate cancer. But there's no particular food that I can say if you eat it, it will prevent. No, yeah, there are some who will say a lot of things. Some will say goosey and all that, but I can't really tell because I don't have any scientific backing. As a doctor, I talk with scientific backing. I do a lot of research. If I've done research and I see that okay, then I can say it with all confidence. But if I have not seen, I've not read an article or I've not, then yeah. Mhm.
Doctor, there's a question here. It said, please, doctor, can a diabetic patient give birth to a healthy baby without diabetes? Must it only be through a cesarean?
Yes, why not? The healthy, you can give birth to a healthy baby. Yeah, their child should not have diabetes normally. Why should your child have diabetes? Can give birth. Why do most of them go through cesarean section? Is because one of the complications of diabetes is macrosomia, big babies. Yes, because of the pathophysiology. And then most of those children they will suffer from hypoglycemia. Yeah,
Then
because
you have that low blood sugar levels.
low blood sugar because the abrupt cottage from your mother that you have been receiving that high dose of sugar. Most of those
Mhm.
children they always. So why do we always do CS? CS is just we are taking more precautions. Why? The baby is first of all very big. Is that baby going to pass? If that baby is passing, do you go and suffer a baby that is first of all suffering from his hypoglycemia and all that to have fetal distress and end up losing the baby? That's why most doctors will not take the risk. They'll tell you that that baby is first of all big. That baby cannot pass. You end up having a baby with a lot of, challenge or deformities and all that. The baby can fracture the shoulder because of the big way. The baby can have head trauma due to delivery. Yeah, just to know that cesarean delivery is safer when conducted by a qualified personnel than normal vaginal delivery. That's the misconception most people don't know. CS is the safest mean.
Africa, like in Europe, that is something that before you even come, it is already planned from your
Yeah,
checkups. It's
yeah,
already planned.
yeah. Yeah, I know the fear in Africa because truth be told, there's a lot of mediocrity. Yeah, I'm sorry to say it. Yeah, because you see people doing surgeries that they are not qualified to do. That's why you see people performing things that they are not qualified to do. There are no checks, there are no scrutinies, and that's why. And that rapport to always talk with patient, educate your patient to understand exactly what you are going to do, why you have chosen. It's supposed to be a two-way thing. You explain and then you both choose together the option. There are some that you impose that no for the safety of this is it. I think when they explain like that, they understand better. Yeah. So that's why you can give birth to a healthy baby and you can also give birth without CS if the baby is not too big. That's just it. Yeah. If the baby is not too big, there's no need for CS. But if they do an estimated weight of the baby, it's already 4 kilograms or 4 point something, no, or 4.5. No, I think
Wow.
I'll prefer to go for a CS. Yeah.
Well, doctor,
But if I have diabetic with my small baby of three, or my baby of 3 kilos, or us Africans will be, why? I'll try the normal vaginal delivery. Yeah. But I make
that's
sure
right.
that I monitor the baby very well, because that baby, there's a high probability that you have hypoglycemia after. So, but once it's being corrected, your child will grow normally like any other normal child. Yeah. Yeah. So that's it.
Wow, doctor, thank you very much. Say Ola Said says some doctors said yellow gari or any gari is not good for diabetic patient. Please, is this true? Because Madam said small portion of yellow gari with good soup cannot spice.
Yeah, diabetic, they'll tell you that all those things, because they contain carbohydrate. That much carbs, which high intake of carbohydrate, is not good for diabetic. I think that's just a breakdown of it. Some people say, oh, Gary is starch, it does not have much carbohydrate. Lies. Gary also has.
Yeah.
It's just that it
Doctor,
won't.
what I normally, yeah, I teach them on how they can eat African foods without spiking them, without
Yeah.
causing them to have high blood sugar levels. But always, Gary is still
Mhm.
starch. So no matter what you do, it's still
Yeah.
going to have an impact on your blood sugar level. But the most essential is for you to know
Yeah.
how much quantity of
How
Gary
much
you are
quantity?
going to eat.
Voila. You could
And
eat, not that
even
you not eat. You can eat. You can eat Gary like yeah. Take my plate, I divide into five. 1 feet of the portion is the small Gary, the rest 4 feet is vegetable and proteins. Why wouldn't I eat? I could eat. But now, yeah, I ration it. It's still caps. So I don't know. Maybe his doctor had a certain way for certain reasons. You know, a doctor cannot just get up and say something. Maybe he had a certain reason based on other things he has seen. That's why he took that decision. So I don't have all of her history. So I cannot just say no. What the doctor said was like, yeah, maybe he had a reason why he said that. Uh-huh.
well, yeah, that is why I teach them also because, like, from what we've heard from our discussion, we've realized that diabetes is not just only about a blood sugar, but it's something that
Voilà.
affects the whole body.
It's
And to
all-
actually take control of this, like you said, surgery is always the last procedure. So it's better for us to mind or to be mindful on what we put in our mouth. Our food is the most essential. To know the type of foods that we are eating, avoid processed foods.
Yeah,
It's not
yeah,
just for diabetes, but for our general
yeah,
health.
yeah.
Yes, that is also very important. So, Dr. Oral, I want to thank you very much on behalf of everybody here. I say thank you very much. And I know we have all learned so much about diabetes and urological problems. And I want to believe you've even tried to break down some silence because there are certain things that many people were shy about, or many people they were even unaware of. But now you've brought it to make it like an open book for them to see through. So I really want to use this opportunity again to say thank you very much for this very important topic that you've taken your time to discuss with us. So if you don't mind, what is your last word for us, especially for those who are managing diabetes or going through any form of urinary tract problems?
Okay. The last word I can say is urinary tract problems, complication in diabetic. They are real and very common that we should be aware of. Uh, Everybody, most especially diabetic, it goes to everybody. Get yourself regularly checked. Yeah. For once you have any of those signs, like I mentioned, be it urinary signs and symptoms, it's always good to check. And the preventive aspect, they are very important. Yeah, like we say, preventive exercise, regular exercise, dietary control, anything that you know that they can do to reduce the risk of obesity. Because this obesity, they are the ones giving all of this complication at the end of the day. It's very important. Yeah, because it will go with a lot of complications. So if we can prevent them, preventive is very important. Okay, it's very, very important. And to always know that they always tell you don't always be scared. Surgery for any form of urinary problems is always one of the last resort. So shouldn't be always scared and all that. Yeah. And for those with the sexual disorders, yeah, you just have to. The first stage is opening up with your partner. It's very important. Yeah, because like I always tell most of my patients when they come, I'm not rushing to always prescribe medication. To me, I listen more, I spend more time talking to them and all that, because you realize that most of the times when we can break that psychological barrier, we are already more than 50% gone, better on a better lane. Yeah. So I think that is just it. What I can say. Yeah.
To see you again. But before you go, there is one question here, and I really want to ask you this question because I've been getting this question, and it's not from the same person this time around. It's from somebody else. The question goes: does a person's blood group matter in eating a bar with blood sugar spikes?
Mm.
Certain food, because especially blood group O, I've been having a repeated question on people being restricted from eating certain foods because they have blood group O. So I don't really know if you can clarify us on this. Thank you very much, Anne Apo, for that question.
Yeah, blood group and blood sugar spike. I don't think so. I don't think so. Unless maybe, medicine change every year. That's why I'm saying that we talk with a lot of facts. We publish studies every day. Maybe there have been a recent study that has something to do. I may go and research and find out. But as of now, I don't really think there's any, to the best of my knowledge, I don't think there is any link between spike and blood group. No, spike of blood sugar and blood group. For now, I don't really, think. I don't know of any. Yeah, maybe a recent study has come out.
So I'm not supposed to eat this food because I'm blood group zero. I'm saying, which one is this?
No, no, I don't
Okay.
know. I don't know of that. I don't know of that. Unless maybe, unless maybe
Okay.
there's something. Yeah, I will go and do my research. If I do my research, I find any article, any scientific, yeah, in an accredited journal that was published that has to do about that. Okay, then I'll
Okay.
read it and digest it and see how their study was done. If it followed the norms and all that of scientific studies, and it was accepted. Okay, then why not? Maybe a possibility.
We'll be happy to have you back here so that you can give us that answer,
Yeah.
please.
Okay, and
Okay.
one other thing, people with diabetic, you should be very careful that one of the most common complication of diabetes, urinary complication, is kidney renal failure. Have it in mind,
Thank you
and
very much.
that's why you have to control, make sure that the blood sugar is well controlled, because the rate of patients that we receive with renal failure is alarming. It's alarming. Yeah, yeah. In my
What is
country,
renal failure? Can you break it down so that they understand what you are talking
ah,
about?
kidney failure. Kidney failure. That means when your kidneys are not working optimally. That
Mm-hmm.
means your kidney, they are not able to filter your blood optimally. What's the job of the kidney? The kidney is that all the blood goes through the kidney. Yeah, the blood goes through the kidney. Males will have averagely 5 liters of blood, mm, and then females will have 4.5 liters of blood and all that. Now, those bloods, they have to circulate in 24 hours about 60 gallons, 60 to 80 gallons. They have to go through the kidney because the heart is pumping them to filter it, to remove all the toxins, as well as to reabsorb the necessary electrolytes that your body needs. So when your kidneys they are failing, they cannot work efficiently. That means most of those toxins will not be eliminated and they will be stockpiled in your blood gradually. And now it can cause so many problems. Imagine you eating the water you drink, maybe the beer you drink, the food you eat, all just stays and it's not being eliminated. So Yeah, kidney is one of the engine of the body, like the engine that cleans the body, the kidney and the liver. Yeah. So when it feels it's not optimal, it will not be able to do that. At one point in time, you realize that the patient will not be able to produce enough urine. So one of the enough urine, there'll be fluid retention and all that, and a lot of vast complication. That's when patient will start saying that, oh, if it's chronic, they may need to get into dialysis. Dialysis is like an artificial kidney, if I may put it that way. That it will filter the blood and send it back to the body. But to know that when a patient arrives that stage, the end stage, the last treatment, the proper treatment should be a kidney transplant, which is very expensive. How many people can afford? Even here in the Western world, how many people? Yeah, there's a long waiting list. So you see what you do. What?
Reach your 10, maybe you are no more there.
Yeah. So it goes down to the point that you have to prevent and well manage for those who are already diabetic.
Talking about the prevention. That is why I wrote my ebook, How to Eat
Yeah.
African Foods Without Blood Sugar
Exactly.
Spike. This book is also
Voila.
a step-by-step guide that is going to help us as African to
Yeah.
prevent all these kind of diseases, all these kinds of failure, complications,
Yeah.
especially when it comes to diabetes. And for those of you who haven't yet ordered my book, you can also check the link in the description box and get your copy, because it is very important for you to take care of your health. Not just about your blood sugar levels, but your general health is very important. They say health is wealth. It is not for anything, it is for a reason. So take care
Yeah.
of your health.
Very important. Health is wealth. Health is
Mm.
wealth indeed. It's only when you fall sick that you know that even if you're a millionaire, all those millions and billions, they will disappear in less than no time. So health indeed is wealth. Yeah, I'm saying it from experience. Health is wealth.
That is
Yeah.
it. Thank you very much, Doctor. I'm so glad, and we are so glad to have you. And hopefully, we are going to have you soon again. Thank you very much.
Thank you too.
Yes,
Thanks.
have a wonderful evening. You can drop down. Thank
Okay.
you.
Okay.
Yeah, bye.
Bye.
Hello, everybody. So that was it. We've had a beautiful day, a great session with our doctor, Dr. Orok. I want to believe you all have learned something. You've learned about the urological problems, what you can do to prevent them. So I say take care of yourself. Like I said, health is wealth. Take care of yourself. For those of you who are struggling with diabetes, know that it is not just about blood sugar level, but diabetes is something that can affect the whole of your body, just like you've heard from the doctor. So I want to appreciate each and every one of you who made it up to this point, and I want to believe that you all have learned something from this show. So if you have any other questions, I would like to answer them. If not, then we'll meet again same time next week. But before we go, if you did enjoy this show of today, make sure to give the video a very big thumbs up. Share it with your family and friends. And if you haven't yet subscribed to this channel, make sure to subscribe for more diabetes health tips, because it's very important that you live healthy without complications. And for those of you who still need to order my Eat African Foods Without Blood Sugar Spikes, please make sure to check on the link in the description and order your own copy, because this is a vital book. Like I said, it is a book where I explain a step-by-step guide on how you can eat well to reduce your blood sugar levels naturally and begin to reverse the symptoms of diabetes. And not only diabetes, you can also use this book to reverse urological symptoms. So I want to say a big thank you to everyone. Cindy say, how can I get the book? Cindy, you can get the book through my description. Just go to my description. Yes, you can order it online. It's an ebook, so it means that you can order it online. Cindy, just go to my description, or you send me an email on diabetesmindfultalks@gmail.com, and then I will direct you on how to get the book, because Even from the EAU, you can get the book directly online. Cindy, just go to my description or even to my community post there. You will see where you can order the book. If you cannot order it there, Cindy, please send me an email using diabetesmindfultalks@gmail.com. If there are no other questions, then we will call it up for today. And next week is going to be another wonderful day. I want to believe we all have learned, because I, for one, I have learned so much today, and I'm so grateful that we did have our doctor in the house. If you have any question for him, always drop them in the comment section. I will make your questions to reach him, and you will always get your answers. So wishing you all a wonderful evening ahead. For those of you who haven't yet liked the video, please make sure to give the video a thumbs up and share it with your family and friends so that they can be able to learn what we all learned today during this show. So see you all in our next show. Have a wonderful evening ahead, and don't forget to get your copy of Eat African Foods Without Blood Sugar Spikes. Have a wonderful weekend ahead. Bye.